Well, about 4 times a year, I like to kind of remind everybody about the statistics, like the batting average of baseball players and so forth, and the number of received passes from quarterbacks. I always like to look at the statistics for the medical trade, the medical system. According to the USA Today, the Institute of Medicine, the Journal of the American Medical Association, and the Center for Disease Control, this came out February 5th, 2007. Each year in America, this is a yearly figure, medical doctors kill, injure, and infect 15 million of their patients in their workplace. Medical doctors kill, injure, and infect 15 million of their patients in their workplace right here in America. Now, each year in America, the number of prescription errors, and I'm not talking about errors that come from the things that go on with the pharmaceuticals, the drug side effects. I'm talking about prescription errors where the decimal point was put in the wrong place or drugs mixed together that shouldn't be, fulfillment problems by the pharmacist. These amount to 1.5 million per year. 1.5 million. Then when you look at infections in hospitals alone, this doesn't count things like personal clinics and big regional clinics and so forth, state clinics. This is just hospitals alone in America, a yearly figure, 2 million infections, 90,000 deaths. Then let's see here. Let's look at some more. How about a monthly figure? Let's go for a monthly figure. And this is for seniors going into hospitals for minor medical procedures and screening tests. 15,000 per month. It's 180,000 per year. And think about that. How many of you over age 65 would fly commercial airlines if you knew that they killed 180,000 seniors, Medicare patients, every year? You wouldn't fly. Now, here comes the FDA. They tell everybody to stop using aspirin for heart disease. Now, wait a minute. They've been telling people to use aspirin to prevent or reduce the risk of thrombotic stroke and pulmonary embolism and coronary thrombosis, I don't know, for maybe 50 years or more. Now they're saying, don't do that anymore. And then you look at all the things they've approved. Vioxx for arthritis pain caused heart attacks in 100,000 people before they took it off the market. Thalidomide caused thousands and thousands of babies to be born without arms and legs. And they never put it on the market, but they did approve it for being given away as free samples. Oh, well, there you go. That makes everybody have fun. This is very scary stuff. I urge everybody to look at simple things. Like, for instance, when you get peripheral neuropathies, doctors want to do surgery right away, right? Atrial fibrillation. Let's install a pacemaker and a defibrillator. Well, they aren't going to work because it's not a heart problem. Atrial fibrillation is really a back problem. And then they'll say, okay, those didn't work. Let's do a ablation. We're going to kill certain portions of your heart muscle, hoping to find the part of the heart muscle that's kind of running amok and causing fast heartbeat and palpitations. Well, that doesn't work because it's not a heart problem, it's a back problem. So then they go to retroversion, where they electrocute you, hoping to reboot the rhythm and the rate of the heart. Well, 95% of the time they wake you up because it's usually in a lab under a controlled situation. 5% of the time they don't. Now, it's not going to work because it's not a heart problem, it's a back problem. And then another thing they'll do is put you on the heart transplants list. They'll run up $500,000 worth of heart procedures when AFib, atrial fibrillation, is a back problem, not a heart problem. And then another one I love is the bladder, UTIs. I get people call me and say, well, I've had urinary tract infections for 14 years. Really? What did the doctor do for that? Well, he's been giving me antibiotics every day for 14 years. Well, insanity is doing the same thing over and over and expecting a different result. If you have burning on urination, you have an irritable bladder, which gives you incontinence, and you're peeing in your pants and can't empty your bladder and all that kind of stuff, it's not a bladder problem. It's a back problem. Okay, you can get a peripheral neuropathy that causes a burning on urination, inability to completely empty your bladder, and incontinence. So what I want everybody to do is get a hold of the 90 essential nutrients. Don't go to your doctor for these things. Get a hold of the trilogy books, Let's Play Doctor, Let's Be Herbal Doctor, the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy. Also, it's the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy. Then in the book, Let's Play Doctor, it teaches you how to do all your own laboratory work, how to interpret all laboratory data you may have saved on file from doctors' laboratory work years before. Now, you can go into a pharmacy without a prescription, get all the same test strips your doctors will use for urinalysis, blood test, and things like that. You can do the equivalent of a colonoscopic exam. You don't have to put yourself at risk from a colonoscopic exam. You go ahead and get an occult blood test. You can do that yourself for like $3. And then the new one out, a FIT test, a fecal immunochemical test. These things will give you the same information that a colonoscopic exam does. Of course, you'll pay $5 for this, but the doctor makes $1,200 when he does a colonoscopic exam. And there is risk of puncturing intestine and killing you from a belly infection called a peritonitis. All right? So why put yourself at risk? Well, you can do all these things yourself. Holidays. Any holidays where all your families can be together for barbecuing, Christmas, Thanksgiving, 4th of July, Labor Day, Veterans Day. Guess what? Give everybody a physical, and you'll save their lives. Then we'll save America, and we'll be back. The dead doctors don't lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I've got one here today that pretty well vindicates you, as this is all stuff you've been talking about for a number of years. And this came from AARP, and the headline reads, 4 surgeries to avoid, reasons to think twice before going under the knife. And although there's 4 here, there's so much information, we probably won't get to them all, so they are all important enough that we'll string this out over a few days and make sure that all of the information gets out to our audience. And they say surgery is dangerous. Body considers an operation a serious insult. Even minor procedures come with major risks, things like bleeding, blood clots, infections. We know how many of those happen in hospital settings every year.
2 million every year.
Yeah, damage to other organs.
90,000 deaths.
Essentially, they say you should know about surgery before you consider it. There's 4 operations. I'll outline what the 4 are here at the onset here, and then we'll get into them. First one is stents for stable angina. Second one is complex spinal fusion. That's where they weld your vertebrae together so that they won't bend any longer. Then you lose range of motion. And then the third one is a hysterectomy for uterine fibroids. And the fourth is knee arthroscopy for osteoarthritis. So we'll start out with the stents one. They say these are mesh tubes that surgeons insert to prop open arteries, and they say if a patient is having a heart attack, a stent can be a lifesaver. However, patients with stable angina, chest pain brought on by exertion or stress, a stent is not better at preventing a heart attack or prolonging survival than lifestyle changes such as exercising, taking statins, or to lower cholesterol. This came from a study from 2007 from the Department of Veteran Affairs. They say despite the stent's ineffectiveness, close to 500,000 are implanted every year for stable chest pain, says Sanjay Kaul, MD and cardiologist at Cedars-Sinai Heart Institute in L.A. And they go on to say for an alternative for surgery, your doctor orders a heart catheterization, because normally when they do these heart catheterization deals, part of the deal is that while they're in there with their looking around with their little camera, they just go ahead and put a stent in anyways. And so they say that if you're going to undergo one of these things, that what you should do would be to ask that your doctor, he or she, do not perform the stenting and do that in a separate procedure if it is required. Make sure you've explored all your alternatives. They say about 20% of patients who undergo this catheterization with a stent do not have any symptoms at all. 30 to 50% have not had a stress test, and 30% are not treated with medical therapy first. And so once again, they say if plaque is forming in your arteries, this is a systemic disease. The stent won't keep even a full inch of your artery clear. You'll still need aggressive medical therapy. We know what causes that, and there's ways to prevent it without even any kind of surgery.
Yeah, and of course, the thing to do when you have obstructed arteries, rather than the kidney, the eye, the brain, or the heart, the lungs, obstructed arteries, Doug, are caused by the same thing: eating inflammatory foods, fried foods, processed meats, oils, gluten, these sorts of things. Certainly not cholesterol. And what I like to do is, we give them the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. We throw in the Ultimate Daily Tablets, which are designed to support and promote healthy blood flows for obstructed arteries, support healthy blood pressure, And then with people really with severe angina where they have chest pain, we don't have the interest in writing prescriptions for nitro or anything like that, which is what the doctor would do. We like what we call HGH because it has the amino acids in there that make the arteries release nitric oxide, and they dilate the arteries immediately, relieving even angina, getting more blood flow to the heart, the brain, the eyes, and the kidneys. Thank you for this one. Warning, America, stay away from your doctor. Stay away from those 4 surgeries. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Charlotte, North Carolina, and Ashley, you're on with Dr. Wallach.
Hello, Ashley, you're on the air.
Hi, Dr. Wallach.
Hi. How can I help you?
Well, I was calling because, I've been listening to your show for a little while, and I've decided that I should go ahead and get on a gluten-free diet, and I did get the Ultimate Classic, the Classic 90-pack.
Mm-hmm.
But there's some other things. One thing, the main thing is all my life I've had to deal with constipation problems. When I was in the 2nd grade, I had to have an enema. It was so bad.
Mm-hmm.
And also, too, I guess in conjunction with that, I've also dealt with weight loss or weight gain problems all my life as well, and I'd like to get some help with these things.
Okay, well, how much do you weigh?
160.
160, and how tall are you?
5'3".
Okay, well, 5'3", I'd like to see about 125 kind of thing. And so you need to lose about 35 pounds, maybe 35 pounds. And let's see here. Do you have any other issues other than the constipation that would lead you to believe you had gluten intolerance? Do you have any skin problems, eczema, dermatitis, psoriasis, any asthma, chronic bronchitis, anything like that?
No breathing problems, but I do get acne in my hairline. Not really on my face, not very often, but it's always in my hairline. Sometimes I get ingrown hairs. And I have peeling cuticles and hangnails, most specifically on my right hand, my index and my middle finger.
Okay. Do you have any children?
I do not.
Okay. Do you have any sisters or brothers?
I have one half-sister, but we don't really keep in contact.
Okay. Is she by the same mama?
No, sir.
Okay, well, that won't count. It would have to be from the same mother. Okay. Yeah, the odds are with a history of kind of chronic constipation, this acne around your hairline, that probably means you do have a gluten intolerance. And since you've gotten on a gluten-free diet, have you lost any weight?
Well, I just started it 2 days ago, actually.
Okay, so you haven't had enough time for that to happen. Okay, good. All right, so the weight problem, and then the constipation is very easy to deal with. For that one, I would get a hold of the herbal rainforest. I'd go ahead and start out with a tablespoon of herbal rainforest at bedtime with a glass of water. And you can fully expect to have regular bowel movements starting the next day. And hang on, we'll come back with Shar and I, and we'll give you the rest of your program after these messages. Okay, Doug, let's go back to North Carolina and Ashley. Okay, I'm going to give you over to Ms. Shar here right now because Shar is going to give you what I think is the best for your health.
Hi, Ashley. You need to get on a gluten-free diet immediately. No wheat, barley, rye, or oats. And for the weight, if you want to lose weight, you can get on the ASAP. It comes in a little dropper, and you just squeeze some under your tongue and let it absorb into your body. And you need 2 healthy bone and joint packs, healthy start packs, 2 healthy start packs. And as you lose weight, if you get down, say, 120 to 130, you can cut it down to 1 for maintenance. And the herbal rainforest will definitely help you with your constipation. Take that at night. It tastes good right out of the bottle. It tastes like peaches, real good. And that should fix you all up. And call us in 2 weeks and let us know how you're doing.
Okay, Doug, let's start another one.
All right, let's head to Los Angeles, California, and Robert, you're on with Dr. Wallach.
Well, Robert, you're on the air.
Hello, Dr. Wallach.
Yes, sir.
Because my dad, he's on he's on peritoneal dialysis, so he's at And so I looked at a YouTube video and where you were saying that you've been able to help people get out of dialysis.
Yes.
would you be able to tell me how?
Sure.
I want to see if there's.
Well, let me ask you a couple of questions. First of all, does your dad also have diabetes?
Yes.
Okay, type 2 diabetes. Okay. Does he have any other issues we need to know about? Any arthritis or high blood pressure?
He has 7 major organ problems.
Such as?
With his heart, he's had a quadruple bypass. He has diabetes, high blood pressure. He has a prostate abscess infection.
I'm sorry, did you say prostate infection?
Yes.
Okay.
He's currently blind. And
what's he blind from?
They're thinking it's diabetic retinopathy. Well, that's what they're saying.
Okay. What else? That's only 5.
That's only 5? Am I missing anything? Yes.
Does he have any liver disease?
Well, not that we're aware of, but he's having these weird, like, either gastritis or ulcer or...
So his bowel problems. Okay. And does he have any skin problems?
Yes, he does.
Okay. What kind of skin problems?
He has, like, boils coming out of his skin sometimes.
Okay. When I was a kid, we used to call that impetigo. They get boils under their armpits and around their neck and behind their ears and all that kind of stuff in the groin area. We used to call that impetigo. And this is more than enough. Your dad has a gluten intolerance. He needs to get off of all wheat, barley, rye, and oats. I mean, drop dead. Everybody in the family, any lady or man in the house, mother-in-law, dog, cat, bird, fish, because of cross-contamination, laundry, food preparation, service, and so forth. And hang on, we'll be back with the rest of this information. But no gluten, no wheat, barley, rye, and oats. We'll be right back. Okay, Doug, we're going right back to California. And Robert, okay, first of all, before we tell you what we think your dad should do, how much does he weigh?
He weighs around 200 pounds.
Okay, and how tall is he?
5'4".
Okay, so he's overweight. And how old is he?
59.
Okay, so let's see, 5'4", I'd like to see him at like 140, something like that. So he's 50, 60 pounds overweight, and he has all this stuff. And so, again, no gluten, no wheat, barley, rye, and oats, absolutely drop dead. I mean, no cross-contamination. I have him get that CD also called Serial Killers so he can learn all the hidden places you're going to find gluten. Everybody in the household has to read that or listen to that CD, Serial Killers. I'd also have him take 2 healthy brain and heart packs per month since he has so many things going on with his cardiovascular system. That will allow him to have 3 of the selenium, 3 of the ultimate selenium at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All that will be accomplished by the 2 healthy brain and heart packs per month. Then for the type 2 diabetes, I'd get him 2 bottles of the sweeties, so he'd have 3 sweeties at breakfast and dinner. Have him take his fasting blood sugar every morning before he medicates himself, and as his blood sugar drops, he'll be able to reduce his medication. When he gets down below 100, 5 days in a row without medication, he's an ex-diabetic. And then because he's on dialysis and he has high blood pressure, I would also throw in, and he's had bypass surgery, I would also throw in the Ultimate Daily Tablets. I'd go ahead and give him 12 of those a day, 4 at breakfast, 4 at lunch, 4 at dinner. That'll be 2 bottles a month of the Ultimate Daily Tablets, and they're designed to support and promote healthy blood flow through obstructed arteries, and they're support and promote healthy blood pressure. And let's see here, he's got prostate infections, and so I would give him the Killer Biotic. I'd let him have 3 of those twice a day. That's 2 bottles a month. And by being on a gluten-free diet, the bowel disease, gastrointestinal stuff should get better on its own just by being on the gluten-free diet. And so I want you to call me every 2 weeks. I want to know how much he weighs. I want to know his blood pressure, his blood sugar. And if I didn't say it, I want him to have the ASAP for his weight challenge. I want him to have a dropper full under his tongue 30 minutes before each meal. So I'll start him out with 1 bottle a month, and have him leave the ASAP under his tongue so he absorbs it through the oral tissues. Don't let him swallow it. Call me every 2 weeks, Robert, and give me all these numbers. Okay, Doug, let's go to callers.
Let's head to Brooklyn, New York. And Paula, you're on with Dr. Wallach.
Hello, Paula.
Hi,
you're on
hello.
the air. Hi.
Hi. Well, pretty much I did a colposcopy a couple months ago, and it came back that I had abnormal cells. They called it epithelial lesion, and they wanted me to do a procedure called LEAP. So I went in to see if there's something else that I could do as opposed to having the procedure done.
Mm-hmm. And what did they say?
Well, they said I needed to do the procedure, which takes out the tissue that has the lesions on it, the cancer cells.
Mm-hmm. And you're talking about the cervix or the uterine endometrium or what?
The cervix is like on the outer part.
Okay, on the outer part of the cervix. Okay. All right. And how much do you weigh, Paula?
105.
Okay, and how tall are you?
5'4".
Okay, so you're slim. And do you have any other issues I need to know about? Any respiratory problems or skin problems? Eczema, dermatitis, psoriasis, rosacea?
No, just really bad acne.
You did have a little acne?
Yeah.
Do you have any children?
No.
Okay. Any brothers and sisters?
Yes.
Okay, do any of them have any skin problems or eczema, dermatitis, psoriasis that you know of?
No, just same acne issues.
Mm-hmm. Okay, anybody have any bowel problems? Like diverticulitis or irritable bowel syndrome, constipation, diarrhea?
No.
Okay. All right. What I would do is get a second opinion from another OBGYN. Okay? If you do not want to agree with their decision or their suggestions, I would go ahead and get another opinion from another OBGYN, get another pap smear and have them look at it and all that kind of stuff. And then, in the meantime, what I would do at 105 pounds is get on one Healthy Start pack per month. I would also get 2 bottles of selenium, and that will allow you to have a half a dose of everything in the Healthy Start pack. It'd be, for instance, 1 tablespoon, which is a half ounce of the OsteoFX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 at breakfast and dinner, the 3 EFA Pluses you could take 1 at breakfast, 1 at lunch, 1 at dinner, or 1 at breakfast, 2 at dinner, and then the 2 bottles of selenium, I'd break it down to 3 twice a day. That's going to support your immune system in case you have dysplasia. Oftentimes, you'll have a dysplasia, and they say, look, you got precancerous stuff going on. It's really just simple dysplasia, which is not. And you get on the nutrients, and that dysplasia will remarkably heal itself. It's amazing how that works. And I would also get a hold, if you prefer the liquid, you can get a hold of the Woman's FX and take 1 ounce a day of the Woman's FX, and 1 quart will last you a month. If you prefer capsules, you can have 3 capsules a day. It'd be 1 at breakfast, 1 at lunch, 1 at dinner, and that'll require 1 bottle a month of the Balance FX. But I'd get another opinion. In the meantime, do all these things. And like I say, when I practiced for 12 years, I saw many, many women that had cervical dysplasia, and I could see a medical doctor who was behind in his Mercedes payments might want to call it a cervical cancer, so could do some expensive procedures. And so get a second opinion and do these things to support the epithelial health on your cervix, and then give us a call after you get the second opinion. Okay, Doug, let's go to callers.
Well, let's head to Louisiana. And Vilo, you're on with Dr. Wallach.
Hi, was that Vilo with a V or Milo?
Yes, as in Vilo, as in Victor.
Okay, gotcha. Okay. How can I help you?
I have a friend of mine has a 2-year-old. She was in the hospital. Well, she's in there now, but the first time she went in there, she was in for the same thing. The first time she was in there, they said she had a reaction from a virus. No, the first time they said she had infection, her lymph nodes were infected, and the bacteria was staph. This time she's in there now, they say is this a allergic reaction from a virus?
Okay, now stop there a minute. Okay, none of that makes sense to me. People don't get allergic reactions to viruses. Does she have any skin problems? Does she have eczema, dermatitis, psoriasis?
No.
Does she have asthma or bronchitis?
No.
Okay, well, hang on. I want you to tell me exactly what's happening why does she go into the hospital after these messages? We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go back to Louisiana and Vilo. Okay, tell me about this 2-year-old little girl. Why'd she go to the hospital?
She's two. She went in first. They said she had an infected lymph node.
Okay.
And they said the bacteria that was the first time she went in. She's in there now again today as we speak, and they're doing cultures, and the doctor says she thinks that it's an allergic reaction to a virus.
Okay, so what is she going to the hospital for? The first time she had a large lymph node. Did she have a fever?
Infected. It was infected lymph node.
Mm-hmm. Well, what about now? Why'd she go in now? Does she have diarrhea? Does she have skin problems?
Her face swole up. Her whole face swole up.
Okay. And did she have diarrhea or belly problems or constipation, screaming because her belly hurts or anything like that?
No, she just, her face just swole up.
Okay. All right. Let's see here. Are there any other children in that same family, or is she the first child?
She's the second. She's the first one. She has a little brother.
Okay. And the little brother is younger than her?
Yes.
Okay. So, and does the younger brother have any problems?
No, he's fine.
Okay. And how old is he? 6 months or a year or what?
He's a year.
Okay, but he has no problems.
No problem.
Okay. What about the mama? Does the mother have any problems?
Not to my knowing.
Okay. Well, it wouldn't hurt to ask. You have any idea how much this little 2-year-old girl weighs?
39 pounds.
Okay. All right. 39 pounds, 40 pounds. That's close enough to 50 pounds. We'll kind of dose her for 50 pounds. And the one thing we don't know, I don't know that anybody ever gets allergic reactions to viruses. That would be kind of outside of my belief level. But I would say she could have, if her face just turned red or she's swollen all up in the face, it is possible that she has an allergy to something, or that she's eating or inhaling or touching, or it could be that she has an intolerance to something like gluten. And so what I would do, I'm assuming she's not breastfeeding anymore or anything like that, and she's starting to eat the regular adult food.
Right.
Okay. Was she breastfed?
Yes.
Okay. Yeah, okay. Many things are possible here because now at 2 years of age, she's mostly on her own recognizance, so to speak, because she's eating her own food. She's not depending primarily or totally on breast milk, so that she's in contact with stuff in the real world. But she was exposed to everything the mother used to eat, because everything the mother used to eat came through the breast milk. And so there is a possibility of a gluten intolerance. I'm not quite sure here, but it's a possibility. So I'd make sure that nobody in the house, including the mom and little brother and dad, anybody else living in the house, mother-in-law, fish, dog, cat, bird, everything must be gluten-free. No fried food, no processed meats, no oils. And I would get her something simple, like the Tropical Plus, which is a couple of juices and the vitamins and minerals. And then I would get her the, unless she's known to be allergic to fish, I would give her the Smart FX capsules. They're little small capsules the size of a pea, and she could either chew them up, little kids chew them up, or swallow them. And I would have her take 2 of those Smart FX capsules a day, one at breakfast, one at dinner. The Tropical Plus, being 40 pounds, I give her 2 teaspoons of the Tropical Plus at breakfast and 2 teaspoons of the Tropical Plus at dinner time. So 1 bottle will last a month, and 1 bottle of EFA, 1 bottle of the Smart FX should last again for a month at 1 in the morning, 1 in the afternoon. Call me when you get more information. When the baby gets out of the hospital, But I'd go ahead and order that stuff and get her on it. Well, thank you, everybody. Really good testimonies today and great questions. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.